I-70 to Kansas City. We're going to speak to a woman by the name of Andrea Ruth with the Missouri Health Advocacy Alliance. Andrea, thank you for joining us. We appreciate you being here with us on the Google Hangout. We've heard a couple of terms tonight that I want you to give us a little more explanation on. The first being job lock. I know this is something you study. What are we talking about when we say job lock?
Great question. So, a lot of us stay in our jobs. We're locked into our jobs, not just because of the pay or the type of work we're doing, but many of us are in those jobs because we need the health insurance, or someone in our family needs that health insurance. And in 2004, there was a study done that showed that 27% of the people they surveyed were staying in their jobs because they needed the health insurance coverage that that employer was providing for them. So people get locked into their employment situation. They don't do things like we were talking about earlier on your show. People have ideas for great innovation. They want to be entrepreneurs. They want to start their own businesses. But because of a health condition, they're locked into that job where they are now, and those kinds of innovations never happen. So the Affordable Care Act gives us an opportunity to actually break out of the job lock and have some people be able to have health insurance coverage, but follow their dreams, start new businesses, create those innovations that we want in our society.
We heard Lou in the package from Vintage Vinyl, and also our business owners around the table talking about healthcare as a tool for recruitment. In your work, do you see healthcare as that kind of a tool for not only recruitment but also retention?
Absolutely. And, hitting on retention, it's very important. A lot of employers know that the cost of, finding new employees when someone leaves and then training that new employee adds to the cost of their business and the cost of doing business. So they prefer that people be able to stay where they are. And that's why a lot of small business owners would like to be able to provide coverage. People we talk with are excited about the tax credits that the Affordable Care Act offers small businesses who want to provide insurance to their employees, be able to keep them, and reduce some of those retention costs that they might have if people left.
Okay, so what if you don't work for a small business? You don't own a small business. You're perfectly happy working in corporate America. There's nothing wrong with that. Does this have an effect on my life if I don't fall into any of those categories of small business?
If you're in an employment situation where your employer's providing coverage now, and many large businesses are, and they provide coverage in what we call a self-insured form, which means the employer's actually carrying the risk of providing you some coverage. If you're in that situation, you can stay in that situation. The Affordable Care Act doesn't change that, and we think that many large employers will continue to provide coverage for their folks.
And help us understand, what is the difference in terms of what a larger employer is up against versus a small business? Presumably, if you're trying to insure more people, it's going to cost more money. Why is it easier? Why is it so much harder? Why is the attention on the small business?
Yeah, that's a great question. So large employers have had an advantage in the current marketplace before the Affordable Care Act because they pool the risk of their many employees and they go negotiate with insurance companies. They're able to keep rates down. They can spread the risk over a larger pool of people, their employees. So, it helps to keep the premiums down, and also those insurance companies are able to negotiate sometimes better rates with providers as far as the provider reimbursement when those employees are sick. So large employers have had this advantage, if you will, for many years. Small businesses, on the other hand, don't have that kind of buying power. And the Affordable Care Act seeks to help them have that buying power through the exchanges where small businesses will have their risk pooled be able to have that same kind of negotiating power with insurance companies, help to keep the rate down and spread the risk over a larger pool of people.
So if it's going to